So my role is really just the opportunity to lead an amazing team of professionals, athletic trainers, nurses, nurse practitioners that are all working out in the field doing injury prevention and injury triage for occupational injuries. So in 1995, we started our first program underneath the Worksite Solutions heading. And then in 2011, July of 2011, was part of an acquisition under ATI, and at that point the program really started to explode. So that's when I turned my focus solely towards the early intervention and worksite solutions program. We are absolutely disrupting the paradigm of occupational health. We're going in there and saying no longer do we need to treat injuries, we need to prevent injuries. We need to get in front of these injuries and make a difference by engaging with people out on the floor and catching musculoskeletal discomfort early in the cascade of the injury so that we can prevent needing to formally go into a treatment protocol. It's a unique approach because it really requires us to engage employees in the workplace floor and to discover the injury, the complaint, the discomfort of pain before it becomes a recordable or before it becomes a claim. So this requires a lot of one-on-one face time between employees and our professionals, which we call certified early intervention specialists. The employees have to trust us enough to engage and to talk about what they're feeling, and we need to be able to get the employees to think about what they may be feeling is not normal. Yeah, it's not normal just because you're 55 to have foot pain. Talk to us about it so that we can help come up with a solution to reduce that discomfort and pain. OSHA recordables are a term for a category of injuries that require a certain level of care. So employers across the U.S. are scoring their success at keeping employees healthy by their recordable rate. That's the number of those injuries based on hours worked in the workplace. So we began our programs really focusing on the early intervention protocols utilizing the certified athletic trainers out in the workforce. What we quickly found is that there's a number of very large employers, Fortune 100, Fortune 50 employers out there that also need the traditional occupational setting. So the nurse practitioner, the nurse, the medical surveillance. We are continuing to build an integrated model of what is called traditional occupational health with the embedded professional out on the floor. That embedded professional becomes essentially the gatekeeper for the occupational clinic. What that means is that if you are an employee with discomfort and pain and you're working out on the floor, instead of going directly into the clinic to meet with the nurse practitioner or nurse, you're going to meet with our athletic trainer on the floor first, and they're going to mitigate the problem and hopefully eliminate the trip into the clinic setting. Once you go into a clinic, employees stop being employees and they start becoming patients. And we want to keep employees doing what they should be doing, and that's working out on the work floor. So what we find is that when we put together an integrated model of the early intervention and traditional occupational approach, we're reducing clinic volume by 50 to 70% because we're taking care of things out on the floor, reducing discomfort, aches, and pains. People are starting to understand the role of the athletic trainer and injury prevention. Injury rates really today are focusing in the industry more on musculoskeletal injuries. So we are the perfect answer for mitigating employers' biggest problem, and that is musculoskeletal pain and strains, which then of course lead to more serious injuries. The other contributing factor is the aging population. People are being forced to work into their 50s, 60s, and discomfort, aches, and pains really have a huge impact on employers' productivity. So, I believe there's a lot of things that are contributing to our growth. The age of the workers, the types of injuries, the fact that employers no longer want to pay the escalating premiums of workers' comp, and also because we are amazing. We have amazing people out there that are changing people's lives every single day and helping them to feel better. That's all about total worker health, and that's who we are.